Have you ever wondered why mastering clinical biostatistics and epidemiology feels like decoding an impossible puzzle? Whether you're struggling to interpret complex research data or aiming to excel in your medical exams, understanding these subjects is crucial for any healthcare professional. Today, we'll break down the essentials from clinical biostatistics and epidemiology made ridiculously simple, so you can grasp the core concepts quickly and confidently. First, biostatistics helps us make sense of medical data by using statistical methods. Think of it as the language that turns raw numbers into meaningful conclusions about patient care and research outcomes. Epidemiology, on the other hand, studies how diseases spread and who is at risk, guiding public health decisions and clinical practices. Together, they empower you to critically analyze studies, assess treatment effectiveness, and contribute to evidence-based medicine. Key points to remember: understand common terms like incidence, prevalence, sensitivity, specificity, and p-values. These are your building blocks for interpreting research. Also, grasp study designs such as cohort, case control, and randomized controlled trials, because each has strengths and limitations that affect results. Lastly, don't ignore how to calculate and interpret risk ratios and odds ratios. They reveal the magnitude of associations in health studies. By mastering these concepts, you not only boost your academic performance, but also improve your clinical decision-making skills. If you want to dive deeper and get the complete, easy-to-follow PDF guide, check the link in the description below. Don't forget to subscribe for more valuable medical insights and share this video with your classmates to help them succeed too. Click the link, grab your copy, and take your understanding of biostatistics and epidemiology to the next level today.